taking some of that money out of Medicare Advantage and putting it into that donut hole does pay for it.
Yeah.
All right, I really breached protocol here, but I thought that was important to just get clear. We are talking about Medicare Advantage in terms of where these cuts come from, not Medicare benefits through the traditional Medicare plan. Javier.
Mr. President, thank you very much for bringing us all together. And I do want to address something that my friend Paul Ryan said, because I almost think that we can't have this discussion any further without addressing something Paul said, and that, Paul, you called into question the Congressional Budget Office. Now, we could all agree to disagree, we could all have our politics, but if there's no referee on the field, right, we can never agree how the game should be played.
Let me clarify. Just
let me, if I could just finish. And so I think we have to decide, do we believe in the Congressional Budget Office or not? Because, Paul, you and I have sat on the Budget Committee for years together, and you have, on any number of occasions in those years, cited the Congressional Budget Office to make your point, referred to the Congressional Budget Office's projections to make your points, and today you essentially said you can't trust the Congressional Budget Office.
That is not what I'm saying.
Well, that was my interpretation.
No, let me be clear.
I apologize if I misinterpreted.
I am not questioning the quality of their score. I'm questioning the reality of their score.
Okay. I take your point on your clarification.
Let me just say it. 10 years of tax increases, 10 years of Medicare cuts to pay for 6 years of spending.
If I could just try to make my point. Okay. So then I'm assuming then that you do believe that the CBO is a legitimate agency to render decisions on spending for the Congress?
You know I believe that.
Okay, so then let's work with that. Because quite honestly, if we can't work with CBO numbers, we're lost. We're lost, because then we really will get into a food fight. And so I apologize, Paul, if I misinterpreted what I had heard. I appreciate that we left the referee on the field.
I'll just simply
if the referee is on the field, then we have to at least accept what the referee has said. And the referee said that the bills that are before us reduce the deficit, the federal government's deficit, by over $100 billion in the first 10 years. The Congressional Budget Office, the referee, not political parties, the referee said that these bills reduce the deficit in the succeeding years, after the first 10 years, by over $1 trillion. Now, you're right. All the discussion makes it clear. It wasn't easy. There are going to be some savings that we extract out of Medicare. What we do in these bills is try to make the point that as we reduce the deficit, we're not going to put the onus, the burden of those cuts on seniors who receive Medicare. We're asking the providers to stop, as some of my colleagues on the Senate said, overutilizing or spending in services, so that we don't see someone having 4 different x-rays for chest pain. And so what we're trying to do is figure out the ways to reduce the cost without impacting benefits. In fact, that's how in these 2 bills that the Senate and House passed, we were actually able to close the donut hole for prescription drug coverage in Medicare and still extract, according to the CBO, over $100 billion in savings. So, Mr. President, I would just say the thing that I would love for us to get into the details of in terms of those deficit reductions that are made is the fact that we do it while putting the brakes on Medicare overpayments that went to insurance companies, which were getting reimbursed at greater levels than were doctors and hospitals that relied on traditional Medicare fee-for-service to provide services to our seniors. We have any number of provisions that deal with the issue of fraud, which it says at least total $60 billion. And working with some of our Republican colleagues, we're doing exactly that, going after the waste that's in the system, certainly the fraud. And that's how we extract a number of the savings. And finally, perhaps one of the unsung secrets of what we learn from listening to doctors and hospitals and all the different providers is that we can actually do a far better job of coordinating care for people. And if you make sure that someone who walks in the door of any one of the great physicians who were in this room when they were practicing and made sure that we followed them through not just that first visit, to the primary care or family doctor, but then into the specialist, and then into the hospital, and then afterwards to perhaps the nursing home or the home health center, that what you do is if you coordinate the care, instead of have each provider do just its share and forget about the patient, if you coordinate the care, you can actually reduce costs dramatically. And that's how we were able to reduce the cost for Medicare. That's how we were able to extract, according to the referee on the field, the Congressional Budget Office, over $100 billion in deficit reduction and over $1 trillion in deficit reduction in the second 10 years. So I believe, Mr. President, what we have is a chance to discuss how we can actually put this country back on a good fiscal track and still do right by our seniors in Medicare and increase the amount of people who get covered by health insurance by about 31 million.
Mr. President, we'll now turn to Chuck.
First of all, to clarify something, if anybody says that Medicare Advantage is a subsidy going to insurance companies, let me say what the statute says. The statute says that 75, with a bid differential where it goes, 75% goes to beneficiaries and benefits and 25% to the federal government.
I'm sorry, Chuck, I just want to make sure that I don't think that doesn't sound right to me, because that would mean 100% of it is going to either benefits or the federal government, which means the insurance companies aren't making any money.
75% to beneficiaries and benefits and 25% to the federal government. We consider, I consider CBO God around here, because it takes 60 votes in the Senate to overrule them. So I'm not questioning a CBO. But in regard to what Mr. Ryan said, I want to back it up with a quote from December 23rd letter from CBO about this double accounting. The key point is that the savings to the Health Insurance Trust Fund under the bill would be received by the government only once, so they cannot be set aside to pay for future Medicare spending and at the same time pay for current spending on other parts of the legislation. Then skip a couple sentences and say to describe the full amount of the HI trust fund savings as both, with emphasis upon both, improving the government's ability to pay future Medicare benefits and financing new spending outside of Medicare, would be essential, double count a large share of those savings and thus overstate the improvement in the government's fiscal position. Now, you can argue about the exact amount of savings or whether there isn't any savings, but you can't argue that you can't count a dollar twice. You just can't argue that. That common sense tells you that. You don't even have to have an accountant tell you that. Now, I think what we want to remember here is that there are consequences to things we do. You change tax policy and there's consequences to tax policy. You decide you're going to save money in certain areas, there's consequences to that. So we have big tax increases. I think that without a doubt, when you put tax on labor, it's harmful and it doesn't do anything to create employment. Both bills hit small business with higher tax rates. The House bill by 33%, the Senate bill by 20%. The House bill hits small business harder, obviously. The Senate bill hits the middle class harder. It's a fact that when you do these things, you hurt the economy, because small business is the machine that brings employment in America, 70% of new employment. We got to be careful how you treat small business. And small business can be, health care needs of small business can being taken care of with these association health plans and other things that can be done to make it beneficial. 35 states have high-risk pools. Most of them, 150%, is the maximum cost. So you can build on those high-risk pools to take care of people that have need, particularly those that would be hit by the mandate and might not be able to afford the insurance without the high cost. The high cost of this bill comes from an unconstitutional mandate. It comes from the fact that for the first time in the 225-year history of the country, the federal government's telling you got to buy something. That just doesn't make sense to a lot of people at grassroots of the Midwest. And if you think I don't listen to my people, I've had 32 town meetings so far this year. I think I have a good feeling of what's out there at the grassroots. Now, we have unrealistic cuts in here. Not unrealistic from the standpoint of the way CBO scored them. Not at all. CBO's God around here. They say we give them policy, it's going to save X